Everyone knows that the psoas muscle can cause back pain and even worsen a herniated disc. But how do you solve this when the problem is a trigger point in a muscle that's so deep? In this video, I'm going to show you a sequence of exercises for you to do at home to deactivate the trigger points in the psoas. And best of all, we won't be using force. We're going to be smart about it. It's a big mistake to try to stretch a muscle that has a trigger point. It's in spasm, unable to relax. That only makes the muscle try to protect itself and get even more tense. So, if you get worse after stretching, it's very likely that's what's going on with you. To diffuse this bomb, we're going to work on this muscle from the outside in. We're going to go step by step, starting with the fascia, a kind of blanket for the muscle. Lie on your back and use either 2 pillows supporting your shoulders and head, okay? Don't just put the pillow under your head. Shoulders and head and your legs bent. The goal here is for you to relax your belly as much as possible. This will make this myofascial release easier, okay? I'll show you here with the shirt on and without the shirt. We're gonna dig as if we were digging using this part of the pinky finger, see? The side of the pinky finger and the tip of the pinky finger. Right here near the hip bone, we're going to press in and pull toward the belly button. Let me take off my shirt here to show you better. That's a lot of shirts, right? It's so cold here today, you have no idea. Look at this. You're going to push the skin toward the hip bone. See? In this direction, push the skin. Dig with your pinky finger, press, go deeper until it feels comfortable. And pull your hand in this position toward your belly button, only as far as it doesn't hurt or cause discomfort. See? Push the skin. Scoop and bring it toward your belly button. Keep making this wave-like motion. Imagine it's a wave in the sea and you're digging in the sand at the beach. Wow, what a beautiful image, but it's really meant to be relaxing. That worked perfectly, look. Push the skin, dig and come back. You're going to dig close to the hip bone. Look, imagine that the hip bone is right here. The wave comes in, digs, and breaks close to the hip bone and comes back, okay? You're going to make this wave motion in a very pleasant, relaxing way from 1 to 3 minutes on each side. Here, besides this myofascial release that we're doing on the psoas, we're improving bowel function because here on the right and left sides are the beginning and end of the large intestine. So you're helping your intestines work better and improving blood circulation to the psoas muscle, preparing for the next exercise. I got the reference. And so we don't irritate the psoas again. We're going to improve its neighbors. After all, many times what stresses us out is who's next to us, right? That wasn't subtle at all. Yes. We're going to work on the muscles below the psoas, the hip flexors, and the neighbor above, the diaphragm, starting with the neighbors below. We will look for the position for you where the hip flexors start to stretch. It should feel like you're stretching out through the front of your hip. I'll give you 3 options. First option, lie down on your stomach. If you're already feeling a kind of nice stretch in the front of your hip, stay in this position. If you haven't felt it yet, move to the next position, support yourself on your elbows. Same thing, if you felt a little stretch, that feeling like you're stretching out in the morning across the front of your hip, stay here. If you haven't felt the stretch yet, just bend your knees until you feel that stretch. Keep in mind, most people will need to bend one leg a little more and the other a little less. Adjust it to find that stretching sensation in the front of your hip. To improve the muscle above it, the diaphragm, we're going to focus on exhaling. Simply keep relaxing as much as you can. If it helps you, use the breathing pattern for stretching. You're going to inhale while counting without forcing it, and you're going to exhale counting to 3. Ready? Here we go. Stay in this position for 3 minutes. The secret here is not to force it and to maintain this feeling from start to finish. Remember, we're being smart about this, not forcing it, of course. And the next step will solve a problem that very few physical therapists know is related to the psoas. If my psoas is here in the front, tense, locking the pelvis and the lumbar spine, there's usually another restriction back here behind the pelvis, the piriformis muscle. The exercise we're going to do now is by far the best exercise I know to release both of these restrictions at the same time. If you feel relief with these exercises, if you want to take better care of your spine, if you want to speed up the treatment you're doing, I have a 2-week exercise program you can do at home. Each day there are 3 different exercises for you to start from scratch and restore the healthy movement your spine needs. I'm leaving the link to Columna Leve down here in the description for anyone who wants more information to learn how it works or for those ready to start the program. But let's get back here. You'll see why this exercise is perfect for these 2 tight spots. You're going to stand here next to the chair. Rest your foot on top of the chair. If the chair is too high for you, choose a stool, a step, or something lower. The important thing is to bend this leg to the side and keep the other one straight, okay? Here you're going to turn. Let me do it like this so it's easier for you to understand. Just look at the genius of this thing. In this position, you're going to turn your torso toward the side of the bent leg. My bent leg is on the right, so I turn to the right. Turn until you feel the stretch in your glute on this side and in the front of your hip on the other. We're targeting the piriformis on one side and the psoas on the other. Look. Slowly, once you feel it starting to stretch, place your hand on the outside of your knee and apply a little pressure as if you're trying to push your knee into your hand, but your hand doesn't let your knee move. Like this. Push your knee outward. Count to 5 and relax. You'll feel a pleasant release on both sides at the same time. Repeat. Push. Count to 5 and relax. Repeat this whole process 10 times on each side. After this work with the psoas, the next step is to correct the straightening in the lower back. I show you how to do that in this video right here. And if you know someone who has back pain, a herniated disc, and doesn't like stretching, send this video to that person. That's all I ask. Let's keep this chain of kindness going. Make this video and help those who need it. I'll stop here. Take care and see you next time. I love the video.